My name is Marie Kilduff, Director of the National Clinical Leadership Centre for Nursing and Midwifery, Office of the Nursing and Midwifery Services Director. I'm delighted to present our last webinar today, Nursing and Midwifery Clinical Leadership during COVID-19, Sharing the Learning, Past, Present and Future. It is fitting that we have chosen this title for this webinar in recognition of all the panellists that have presented to date. Our very first webinar was back in September 2020, when you would have heard from our CNO, Rachel Kenna, and the Director of the Office of Nursing and Midwifery Services, Dr. Geraldine Shaw. And we're absolutely delighted to invite both Rachel and Ger back today to present on their experiences of leading during the past year, and also to reflect on what they've heard from the webinars to date. So without further ado, I'm going to welcome Rachel Kenna, our Chief Nursing Officer. Rachel, you're very welcome.
Thanks, Marie. I'm delighted to be here.
So Rachel, just really, it's been over a year since we had you on our very first webinar, and it was an absolute honour to have you present at that time. But so much has happened in that year, and we do know that the COVID-19 pandemic has changed how we work and live. What has been the experience within the Chief Nursing Office?
Thanks very much, Marie. And first of all, to acknowledge and say that I'm delighted to be here at this stage, as opposed to when I was first appearing on this series of webinars. I'd like to acknowledge all of the people that have presented on these webinars, because they have provided such interesting insight into all the different roles and contributions to healthcare at such a very, I suppose, extraordinary time. Throughout the pandemic, and as we move forward in nursing and midwifery, you can see that we have stepped up, provided leadership that was needed to navigate really complex challenges that we all faced over the last 18 months. It's been a real privilege to be in my position and see the resourcefulness, the innovation, the determination that was demonstrated throughout the whole workforce by everybody. We've all been affected by this pandemic, and some of us have lost colleagues, we've lost loved ones. For me personally, I was appointed as chief nurse after the pandemic was declared in 2020. So some would say that I knew what I was getting into, but it certainly made for a very tough induction period. However, I knew that my primary role was to work collaboratively and collectively across government and across the health services to ensure that nursing and midwifery were able to respond to the needs of the population at the time. And a lot of those were unknown, so it was very fast and it was very quick decision making that was involved in a lot of that. We had to look at the available workforce resource and how it could be best deployed, and we identified the unique resource, say for example, of student nurses and midwives during their summer breaks to contribute to the national effort and support them to do that. In collaboration with the regulator, for example, we were able to remove barriers, allowing us to increase the necessary capacity of professionals to respond to the service needs, vaccination programs, etc. The other thing that I didn't talk about for when I was here the last time was, as a member of NEFIT in the Department of Health as Chief Nursing Officer, that was a position that I was in and very fortunate to be in, working in the Department of Health, and it was enabled me to make and provide nursing and midwifery solutions that were both known to NEFIT and tell them how they could be used, but also recommendations for NEFIT then on how to mobilise and use the nursing and midwifery workforce, ensuring that we could respond appropriately at the time of crisis. Worked very closely with my colleague, Dr. Geraldine Shaw, who's on this webinar with us today as well in the ONMSD, and it was vital that we agreed and services and policy were aligned so that we could actually maximise the capability of the workforce. I also capitalised in my position on the international network of nurses and midwives that we had access to. Myself, I worked very closely with Charlotte McCardle, the chief nurse in Northern Ireland, but also we had regular contact with my counterparts in England, Wales and Scotland, as well as Australia and New Zealand, because we were all experiencing different challenges at different times. So that that was a really useful network and resource. And it was great to support each other at these times, because we were all having different experiences but similar challenges, which meaning that we were able to collaborate and maximise the resources that we had together ourselves. And I was able to then apply them to the Irish context with our own colleagues and frontline staff. I suppose then, just to finish off, your question is, so many of our colleagues entered the pandemic as novices in technology and digital healthcare, and I myself being one of them. But we've quickly progressed to almost being experts in this area in a lot of areas of care, and using like virtual platforms to conduct our business. For example, these webinars have been a huge source of, information and comfort a lot of the time, when we've connected together, and we've adapted many other ways of working for the better. And that has been a really interesting view for me in the Chief Nursing Office in terms of thinking of the future.
Rachel, you make it all sound so easy, but I know it's been a challenging year as well. But I really think it's wonderful the way you highlight the opportunities that we've been presented with in terms of, collaboration with Charlotte in the north, which you would have had. It's been strengthened with the UK. But I'm also hearing about your influencing role with NPHET, which is really, really important for our listeners to know, because that nursing and midwifery voice at that very senior leadership table during the pandemic is absolutely key. But, Rachel, you always take on everything with ease. What people would say about you is, you look as if it's all so easy, but I'm sure there are key challenges that you have faced. And can I ask you, what have the key challenges for you and your team in the Department of Health been in the last year?
Yeah, gosh, Marie, that's a great question. And I suppose there have been many, in fairness. I suppose the Department of Health had to move very quickly to adapt the policy position of supporting COVID, essentially. And we had to balance that with leaving perhaps other really important key policy work to one side so that we could put as much resource as possible in there. And of course, nursing and midwifery were central to all of that. But at all times, any policy decision that was made or required needed that patient safety lens on it. And that was extremely challenging when you're making policy decisions and putting money towards patient care in extraordinary times, to actually be in a position there where you have to still think of at all times patient safety. So that was really, really key. And the nursing and midwifery voice, whether it was the vaccine task force, whether it was NPHET, or whether it was the political system and giving advice in that context, that was really, really challenging. I suppose it is important to acknowledge as well the cyber attack and the impact that had. While it was nothing in comparison to what happened in services in the HSE, it certainly did impact on the department and our ability to move things through the political system as well, in terms of supporting important decisions. And I suppose the pandemic brought about significant changes in the way that we access and deliver care. And it created an environment for integration and new ways of working and innovation. And I suppose that was all the positive stuff. But the challenge around that was that it was moving very, very quickly. And my role then as Chief Nursing Officer was to support this change and making sure that we had policy kind of embracing it and making it robust, so that nursing and midwifery had the tools to respond and that they were supported in their work. That took a huge collaboration on a daily basis with frontline staff, ONMSD, the regulator, and again then other departments from a government perspective. So ensuring that communication cross-government, cross-department, across the services, that was really, really challenging at a time when, I mean, people were almost working 24 hours a day. So taking that into consideration as well. And then keeping the patient focus and making sure that everybody else had that patient focus. And I felt that was a really important part of what I'm in the department to do. But it was challenging because you're putting out fires in the context of a pandemic. And I suppose at this stage, as we're emerging from it, you can see the things that we did well and that worked well. And that was the collaborative approach. So keeping that and the flexibility that was, I suppose, found through that is going to be really important going forward. And that's not going to be without its challenge either. And I suppose as chief nurse, my responsibility was and is to design policy solutions in line with Sláintecare. And Sláintecare got sidetracked in one way during COVID, but also got kind of rushed into position, and so much progress has been made. So keeping Sláinte Care strategy very much to the fore of what we do, and all of the government priorities that arose during the time, and making sure that we could respond to both ends of that as we emerged from this crisis as well, was really important. But again, wasn't without its challenges in terms of what do we need to prioritise, where do we need to focus, and always then thinking of the patient and the other impacts of the pandemic. And I guess that's kind of into the future then as to where we go. So lots and lots of challenges, but I suppose in tandem with all of the opportunities as well, Marie.
Rachel, thank you. And you've eloquently presented the challenges, but also bringing in the opportunities, and they go hand in hand. There has been difficulties for everybody during the pandemic, as you've mentioned. Also, the cyber attack compounded the situation for many, but there has been opportunities that your office have experienced during the pandemic as well. And I suppose the title of this webinar is Past, Present and Future. And I'd be really interested in hearing, the lessons learned for yourself, Rachel, as our Chief Nursing Officer. What does the future hold? And I suppose, what's your vision for nursing and midwifery in Ireland going forward?
I'm really glad that you asked me that question, Marie, and I'm going to take license as chief nurse now and talk for a bit because I've plenty to say on this question. So bear with me, but a great opportunity. So I suppose the pandemic brought many changes to the way we care for our patients, how we deliver care, but it also changed the way we work. And I mean, we moved into a virtual office space, and I suppose traditionally the chief nursing office would have been office based in the Department of Health, which meant that, we didn't probably capture as much of the expertise nationally as we could in terms of getting the people into position of policy that were interested in it. So from that perspective, I see that as a huge benefit to what COVID has brought us. And so currently some of the nursing and midwifery team that work in here have come from much further afield and brought really rich frontline experience to the policy arena, which is fantastic. And that input will provide a better perspective and bring a greater understanding of the challenges collectively and nationally that we're going to face. And that's what's really important from a policy perspective. So as a first off, I feel the office is stronger as a result of COVID, which is great. I suppose nursing and midwifery have remained very visible at the forefront in the pandemic response, but also, they did a huge amount of work behind the scenes in maintaining core services. I have continued to learn so much from my engagement with frontline nurses and midwives, and they have continued to influence my vision, which has, I suppose, not changed, but certainly grown and expanded as we've come out and learned of what COVID has done. And in the context then of Sláinte Care and me getting a greater understanding of what that means for nursing and midwifery, I see that we have huge opportunity. We have a unique opportunity to learn from the COVID-19 responses and transform the approaches to workforce planning and ensure a sustainable workforce for the future. And I think that's a key feature of what we need to be focusing on. During the pandemic, we saw approaches to workforce, for example, that have significantly improved patients' quality of life and patient outcomes, their experiences and the experiences for their families. One example of that, and I have to bring it to attention, is the community call framework that went into place. And it saw social partnerships between healthcare professionals, local councils and voluntary organisations, and determining the most effective approaches then to deliver citizen needs and care needs. And that's one example of the types of coalitions that nursing and midwifery communities should be building on in the future. And reflecting on the impact then of this model of care for the future workforce planning and how to support nursing and midwifery to do their jobs better will be a key focus for me in terms of building policy around that. And I think it'll be really important in terms of informing effective and efficient ways to deliver on universal health coverage, which is the big question and the big ask of all of us. Another great example of this was building the enhanced community care model, which had greater access to specialist and generalist knowledge for people who needed healthcare and nursing and midwifery input, and also the skills then to support teams to grow professionally, personally, and fostering that fantastic peer support that we saw so visible during COVID-19. I think from my perspective, we're at a really important juncture with the report of the expert review body in nursing and midwifery that's due to be published shortly. This body has spent nearly 18 months reviewing the professions, and we already know that the report, which is due soon, will be framed around the themes of leadership, workforce, governance, digital health and education. So these are going to be key strands of policy work that we're going to be working on over the coming years. And the recommendations from this body will influence policy and practice of how nurses and midwives will deliver care for at least the next decade. So it's a really important and significant piece of work. And while it was difficult to keep it going during COVID-19, it was a really important perspective to have included in it for moving forward. So again, like I said, in terms of workforce planning going forward, one of the priorities of workforce planning is to build a strategic approach into the whole healthcare workforce. And we're facing challenges in providing a workforce to meet the population changing needs at the moment. So people are going to be living longer, they're going to have multiple comorbidities and much more complex needs as we move into the future. And this will mean an increase in the quantum of services that is required also. As the largest section of workforce, nursing and midwifery have an opportunity to lead on this and show everybody else how it is done. And the reforms identified in the Sláinte Care Reform Programme, Teams of the Future, are centred on planning and building and supporting a health and social care workforce that can deliver on these reforms, as well as initiatives to promote change and innovation. The Strategic Workforce Planning Unit, which currently sits as part of my brief outside of the Chief Nursing Officer role here in the Department of Health, again is a wonderful opportunity for us to be able to influence and build on that. And we have started an important EU collaboration in terms of building a whole healthcare workforce which is critical to deliver reform across the board. And we're going to get the input from experts all over Europe that's going to support us. And obviously, nursing and midwifery are going to be a central focus in terms of that. So that's really, really exciting and showing how that nursing and midwifery are growing with strength within the policy arena in terms of informing how we do it. And I suppose then in terms of supporting this, another focus that I know that we will have to turn our heads to is strengthening the capacity for data around workforce and ensuring that we have better data collection and better analysis of that data in order to effectively accelerate and implement National Healthcare Workforce Coalition of Nursing and Midwifery data. Our data isn't strong at the moment in terms of workforce, so developing robust health indicators is challenging due to the agile and complex health environments that we work in, but is critical in order for us to be able to get this right and actually build a workforce that's going to be able to support the demand that we're going to be facing. However, defining the domains and health indicators of care delivery across the nursing and midwifery system is starting to point to how we examine and deliver integrated care. So the delivery of integrated care, Marie, again, is another really important focus over the coming years. And building this coalition of knowledge, which is shared across nursing and midwifery professions, is going to be vital for the future. So again, knowledge building and data management and data analysis are going to be key. Examining all of this then and having access to this rich data will provide the essential information to assist again on delivering universal healthcare coverage. We can't talk about universal healthcare coverage unless we incorporate the needs of the population, informed investment, and that includes knowledge on our workforce, our education, and any changes in regulation then and legislation that are required to support any of that is much clearer in terms of policy development. So that will be really, really important. The safe staffing framework is a policy that everybody is familiar with, and this is going from strength to strength. And as you all know, that this is now in phase 3, and that important work has continued again during COVID-19, but it's a really important focus for the future. And it has the opportunity as well in phase 3. It has taken on the complexities and I suppose the challenges that we witnessed during the pandemic to align them to the planned reforms under Sláinte Care. And as you can appreciate, this is really, really complex, but very necessary. And it is the first time that we will bring the public and the private system together in terms of getting the workforce mix right as a result of that. I also acknowledge that the implementation of the safe staffing framework and its success has been delayed due to the cyber attack, but despite all of that, we have still made significant progress in implementing it into our most complex hospitals on the island, which are the Model 4 hospitals. And just to acknowledge that that's a huge milestone that we're hoping to achieve completion of that in the coming years, while we still develop the other phases, completion of that this year, I should say, as we still develop the other phases over the coming years. So that is fantastic. And I suppose then just to acknowledge, I will be focusing strongly from a policy perspective on how to support innovation. One example of this is our community virtual ward, which has been developed in collaboration with the ONMSD again, and we tested it through a proof of concept test during COVID-19. And that has shown us that the results of that can facilitate really, really positive staff and patient outcomes for delivering care in the community. It's an innovative way of delivering care, and it bridges the gap between the acute and community by reorientation of the nursing and midwifery workforce. So it's a fantastic opportunity for us to grow innovation, and I certainly will be trying my best to support that through policy, because there's a significant change in how nursing and midwifery care can and will be delivered. And this is another new, I suppose, challenge for us, as well as looking at it as a new frontier. As we had a conference recently describing new frontiers, this is definitely one of those opportunities for us to operate in now. So further development of health information and technology systems to support real-time data in terms of delivering innovative care is going to be, again, really important in terms of us allowing us to build innovation. And the utilisation of technology during the proof of concept test in the community virtual ward shows us the success through the evidence that we gathered at that time. So that's going to inform how we can build policy around ensuring that we have good, robust processes to allow us to deliver innovative care. We've had some important, I suppose, strategy documents over the time as well that are going to have to be considered as part of the future. One of these, I think I should mention, is the COVID-19 Nursing Home Expert Panel report that was published in 2020. The panel's key findings and recommendations reflect lessons learned during the pandemic, international best practice, and aims at safeguarding residents in the nursing home environment into the future. There's obviously a big piece of work around policy for looking after our older people, particularly in this setting. And this was really key information, and these recommendations are definitely going to inform the future of policy development in this area. And nursing and midwifery had key roles in developing these recommendations and input at the early stages, which is important. And they are essential then for implementation to assure that we are going to get policy that translates at the point of the patient. And that's a really, really important part of our role, to make sure that patients and residents are cared for and protected. And I suppose I can't go away without saying our advanced practice across nursing and midwifery has grown from strength to strength throughout. And this has definitely shown us that we have the capacity to, to keep delivering and to respond to change, that we are a really agile workforce. But the advanced practice has brought innovation, leadership, and has radically changed how nursing and midwifery can respond and deliver care. We currently have over 500 registered advanced practitioners across the country, and another 185 in candidacy posts, which will be coming to fruition very, very soon. To the extent that they have been so visible and their contribution so known in terms of the massive impact that advanced practice can have, we have got significant support from the Minister in the context of growing this for the future. So I will certainly be looking at, in collaboration with Dr. Geraldine Shaw and her office, how we can increase this across the workforce from 2% to 3%, and doing this with an eye to the patient, universal health coverage, and really maximising the nursing and midwifery resource at the top of their licence to impact on patient care. And back to the patient, which is always the focus, was really, really strong workforce at that level, autonomous practitioners. So in conclusion, what I would say is there have been so many challenges, but you can see that I have a real hunger to move forward with all of the fantastic work that we can do. I'm definitely an optimist, as I think most people who know me would say, but I do acknowledge that while a lot of work has been completed, we need to ensure that the lessons learned during COVID-19 support the work that we have to progress over the next number of years. And this is the only way that we're going to ensure the health sector has the right people with the right skills in the right place at the right time. And certainly I see that as a hugely important feature of my work going forward.
Rachel, I'd just like to compliment you. That's a huge amount of work that's been done, and I know from when you presented in September 2020, your vision was very broad and it was great then, but you've certainly grown it, and in the last year, despite what we've been through, pandemic, cyber attack, you've actioned a huge amount of what you'd hoped to do back then. So I just would like to wish you and your team the very best. I also know the collaboration between yourself and our own office and Dr. Ger Shaw is so strong, and it's just admirable in the way you work together to action and operationalise the policies. So Rachel, I can't let you go today without asking you, because we've many listeners here today, our nurses and midwives, who I know value the messages from yourself and Dr. Ger Shaw. And back in September 2020, we did ask you for a message back then. I know on the International Day of the Nurse and Midwife, you gave further messages. We're now in October 2021, and we've been through another difficult year. But I know from you, yes, you definitely are extremely optimistic and hopeful, and you've given me hope as you talked about all the things you're going to do and the initiatives, and I know they will happen. What would you like to say to our listeners today about, where they're at and how can they keep going in the challenging times that we're facing?
Thanks, Marie, and that's a really important opportunity for me. And as you said, we've come so far over the last 18 months. So the first thing is that our role and contribution has never been more visible, and the reliance on us as professionals is greater than ever. So as we emerge from this crisis, we have so many opportunities to keep evolving in line with our patient needs. And that's really important to every nurse and midwife that I have ever spoken to. I'm going to be a little bit cheeky first with my message and say, when I first came on this webinar series, I reminded everybody to get their flu vaccines. So I will remind you all again and say that's really important of keeping ourselves and our patients safe. So I'm really proud to hold this position and get that opportunity to be able to remind everybody. But as a final message, I would say that we individually and collectively have had a very tough couple of years. And while the future is exciting and there is so many opportunities, the road ahead is not without challenge. So what I would say is, first and foremost, to look after each other, to embrace the opportunities for development, to take some time and refocus, and to try something new in the world of nursing and midwifery. And I would challenge everybody to do those 4 things. Ideas and expert knowledge are what make really good policy. So I am really excited to work with you all over the coming years and see what the future holds for us. And just to thank everybody for the support and collaboration over the last 2 years. I do feel we're at a stage where we can say we're emerging. Life is somewhat returning to a new normal. It'll never go back. And again, just to say that the support, collaboration, and all of the innovation really showed us what we can do. So never lose sight of that.
Rachel, thank you so much. That is a fantastic message and really hopeful for everybody. And I would urge people to take on board what Rachel has said. And I know you're extremely busy, so we really do appreciate you taking the time to present today and to return to us after the year to give us your ideas and where things are in terms of past, present and future. So thank you, Rachel.
Thanks, Marie.
I'm now delighted to introduce Dr. Ger Shaw, and Ger, we've mentioned your name a good few times there as our second most senior nursing midwifery leader in Ireland with Rachel, and you work very much together, as I've said, and we're delighted to bring you back again after a year as well to present to us today. So Dr. Geraldine Shaw is the Nursing and Midwifery Services Director and Assistant National Director in the Office of the Nursing and Midwifery Services Director. Ger, you're very welcome here today.
Thank you, Marie.
So Ger, my first question is, again, you've returned to us and it's 13 months since you last presented on our webinar series. So like Rachel, so much has happened in the world of healthcare since you recorded the first webinar. Would you like to highlight some of the key challenges and possibly opportunities that were presented to you since September 2020?
Great. Thanks, Marie. And first of all, like Rachel, I would like to reiterate to you and the staff of the NCLC and to Tina and Caroline and our colleagues in the RCSI. And thank you to all the participants in the webinar series that has occurred over 2020 and 2021. And thank you all for showcasing it and the exemplars and the great examples of what has happened in nursing and midwifery practice. So at the outset, I just want to reiterate that, like Rachel. So thinking back to September 2020, and my goodness, it's hard to kind of think back really, you know, because as all of us will have experienced and all of the listeners will have experienced here today, that, you know, it was difficulty sort of telling one day from the other what day of the week it was at different times, you know. But reflecting back to September 2020, at that stage we had gone through 2 phases of COVID-19 here, and we were kind of, you know, hoping that we might be coming out the other end of it. But little did we know that actually a 3rd wave was to occur in December 2020, followed by a 4th wave in July 2021, which we're actually still in at the moment, and fingers crossed we're trying to move out of that stage. But additionally to that, then we're also faced with a new variant of COVID called Delta, which was actually a lot more viral and strained than previously had been here before. As Rachel has said already, you know, from a nursing and midwifery perspective, you know, in order to be part of that crucial workforce to vaccinate the nation, which was a nationwide priority and a global priority, ourselves in the ONMSD and with our colleagues in the services worked with Rachel to develop those statutory instruments then, which was required to remove any, you know, underlying barriers that limited the practice of nurses and midwives, so that we could become, you know, frontline and centre in the whole mass vaccination programme for Ireland. And that took quite a bit of work. A lot of it was done, you know, like many people in our professions that have worked, that a lot of that was done late at night, over weekends, you know, trying to get things done at pace, you know, so to appreciate all of the work that everybody, not just in the ONMSD family or the CNO's office, but right throughout the service, people worked all kinds of hours to deliver on all this, which is really, really good. So underpinning those statutory instruments then in the vaccination programme, the ONMSD family, as I refer to it, which is the ONMSD leadership team, the NMPDUs and the CNMEs. Collectively, we had to develop guidelines, protocols, and deliver and develop virtual and essential face-to-face education and training for not just nursing and midwifery, but for all of the professions that then were to be involved in the vaccination programme. And that took a tremendous amount of work, as you can imagine, in terms of dealing with that within the confines of what we had at the time. So I suppose just to kind of remind people really that on St. Stephen's Day, December 2020, the first shipment of COVID vaccines arrived in Ireland. And 3 days later, on the 29th of December, the vaccination programme began. So if we can sort of put that in perspective at the speed at which the system and people were operating on, it was just enormous and tremendous, you know. And through that, the significant contribution that nurses and midwives and the leadership shown across the rapid changes that was delivered across the health system by the nurses, the midwives, the student nurses and midwives and the healthcare assistants that had to adapt to the changing local and national policies, any emerging data trends, scientific discoveries that we were dealing with as we went along this journey, all of the surge capacity requirements that occurred along the route, and then the necessity for mass vaccination of the nation. So tremendous work and altering, you know, trends and directions all of the time, you know. So as well as that, then the system had to try its best to sustain what was, you know, normal services, normal patient services, as well as dealing with the new requirements that were occurring through COVID-19, and additionally then mass vaccination as well. And from the perspective, as Rachel has already mentioned as well, in our case in Ireland, we had to deal with a crippling cyber attack, which again called for further contingencies and new ways of working on top of what we were already doing with COVID. So there was lots and lots of challenges along the route since September 2020, and those are just kind of, you know, a few of them.
Chair, thank you. And, you know, it's sometimes you forget what we have actually achieved in the last year, despite the challenges, and you've really highlighted them there. And the pace, I think the pace is so evident today from both yourself and Rachel. Everything had to be responded to very quickly. And as you give that example of, you know, the New Year's, the Stevens's Day, and then everything happening so quickly, I just think our nursing and midwifery workforce have responded so well. And I'm just interested, as I'm listening to you presenting about how you and your team responded to the challenges presented, what opportunities emerged during this time, Ger?
In answering the challenge that the pandemic brought about for nursing and midwifery, Marie, nursing leadership validated its role as thought leaders, as operational innovators, trusted partners, forming coalitions with other engaged disciplines. And a number of examples of that is that during this pandemic, we saw coalitions develop between government, policy, strategy, healthcare individuals, healthcare teams, organisations, professional associations, academic institutions, regulators, defence and Garda forces, volunteers, to name but a few, that all came together with a common goal in fighting this invisible enemy, which was COVID-19. In normal circumstances in our profession, nursing and midwifery, we draw upon and we're taught to deliver practice based on evidence. But on this occasion, with the pandemic, this required nursing and midwifery leaders and nurses and midwives throughout the system to operate without any discrete data or a roadmap or a blueprint to guide us along this journey. So it required nursing and midwifery leadership to adapt to the evolving crisis, analysing evidence in real time and monitoring for any data trends and changing the course of the journey along the way. So for nurses and midwives and nursing and midwifery leaders, they had to make timely, calculated decisions affecting the health and safety of both patients and staff without any complete data and evolving all the time. Opportunities presented themselves, and Rachel has alluded already to digital and e-health, so we had access to wide-ranging and use of telehealth during this time. Virtual platforms for nurses and midwives were offered as a bridge to patient care, and there was lots of examples along your webinar series where people and nurses and midwives, created that interaction with patients through virtual platforms. We also utilised e-health and digital for education and training. For remote work, it facilitated mobility and portability of relationships, and it also allowed for interactions and operational processes that otherwise, would not have taken place. There was great coalitions with academic partners, and Rachel referred earlier to students, and so the partnership with academics enabled creativity around placements for students, which allowed them to continue on their course. But that creativity also allowed and enabled the student cohort to join the workforce to support the pandemic during a certain period of time. Within the HSC, from the nursing and midwifery cohort with HSC HR, in collaboration with professional bodies of union representation, there was coalitions formed and collaborations which allowed for the mobility and redeployment of staff and different arrangements which allowed us to be in a better position to manage the pandemic. As Rachel has said already, there was cross-border coalitions with Northern Ireland, and certainly from here in this country, we certainly supported Northern Ireland quite a bit from the nursing midwifery perspective in sharing all our, what we had done here with education and training, with staff upskilling and redeployment. And also from a service point of view, we allowed for reciprocal arrangements for a patient transfer if it came to that. And as Rachel has already said as well, the international coalitions and collaborations was really useful. Through Rachel, who we were in constant contact, I would say daily throughout all of this pandemic, and certainly during all those waves, that we were learning from international colleagues, and we were utilising that learning here in Ireland across our nursing midwifery workforce. So there's just a couple of examples, Marie.
And Ger, like Rachel, I'm just in awe of all the opportunities and all the work that was done, and you really did make use of the opportunities, and you know there has been fantastic positive outcomes from that. We have learned so much from the pandemic, and we've heard that from yourselves and from everybody who's participated in this webinar series. We know it's not over at the moment, but it's certainly a lot better, and we're in a lot better place with our vaccination process since the last webinar when yourself and Rachel presented. We are now definitely beginning to turn our attention more towards non-COVID priorities. And I'm just wondering, Ger, from a nursing and midwifery perspective, what are the key priorities for the ONMSD team for short-term to medium future?
Thank you, Marie. And well, as you know yourself, and so any priorities for the ONMSD are set within the context and aligned to government policy and strategy. Any national strategies that are available, the HSE corporate and service plan, and also our priorities will be aligned to any emerging recommendations or priorities from the expert review body on nursing and midwifery that Rachel referred to earlier. Our priorities are aligned and guided by any regulation matters. So just to set it in context as a first port of call. So generally speaking then, our priorities are centred around strengthening the capacity and capability of the professions of nursing and midwifery. And we do this by initiating and supporting work to strengthen clinical leadership, as you and your colleagues in the NCLC know all about and have done an exceptional job in continuing to do that and make available education and training and learning for our future leaders. We want to support our clinical workforce to improve patient and service user experience and to improve quality and safety. That is at the cornerstone of everything we do. We've heard already about digital e-health, so we support and prepare nurses and midwives to integrate healthcare information and digital technologies into nursing and midwifery, in practice, in education, in research and in management. And that's all aligned to, in the ONMSD with our colleagues both in services and the CNO's office, we've published a digital roadmap for nursing and midwifery here in Ireland, which, you know, we're ahead of other professions in that and indeed ahead of many other countries as well. And that roadmap then will guide us in terms of digital for nursing midwifery. But aligned to that then, just about to be published very shortly now, is a digital capabilities framework, which sets out in more detail what nurses and midwives at every level should aspire to in terms of their education and training. It also provides a guide for their managers in terms of what they should be focusing on in terms of development of their workforce. And it provides a guide for the organisation as well. So we're very excited about all has been developed along the digital field. We continue to support, the existing roles and scopes, as well as any new emerging roles that are coming on board to support implementation of Sláintecare. So we will support the extension of scope of practice for nurses and midwives, like Rachel has said, to enable people to work to the top of their licence. We continue to support the implementation of the framework for safe staffing and skill mix, as Rachel has referred to, and we're delighted to support that really important piece for nursing midwifery here in this country. We continue to support nurses and midwives to develop themselves between graduate to advanced practice, and that takes in, from the staff nurse, staff midwife, the enhanced nurse, enhanced midwife, all of the manager grades along the route to clinical nurse specialists and advanced nurse and midwife practitioners. We provide access to continuous CPD for nurses and midwives, and we also support postgraduate education for nurses and midwives. And we are also open, continuously looking and scanning the environment for the requirement to develop anything new in this area, which may be required to support implementation of Sláintecare and patient care. We continue to support services in the rollout of nursing and midwifery quality care metrics, very important for quality and patient safety. We continue to work in collaboration with our nursing and midwifery colleagues in the services to support innovations and improvements in patients' care. And Rachel has already referred that that area of innovation and improvement is an important goal for her as well. And then we aim to develop on our work and collaboration with other professionals, within the system. So again, from a nursing and midwifery perspective, to work in collaboration with our health and social care professionals, our doctor colleagues, and right across the board in terms of, general and other grades as well. And within all of that as well, our priorities will also be set within what are the priorities of the CNO and her priorities from a policy perspective in the Department of Health. So that's kind of a broad broom in terms of, our focuses, Marie. But as you know, as the ONMSD in the office in the HSE, we, can change our priorities at any given time, depending on what is the priority of the nation. So it's broad broom.
Chair, thank you so much. Like Rachel, I'm just in admiration of both of you for all of the work and for your vision as well, Chair. It's just wonderful, and the priorities are so important. And I know our listeners will certainly be very appreciative of what you're hoping to do and what you are doing with your team presently. Chair, like Rachel, it was wonderful for us to create an opportunity for both of you to speak to nurses and midwives at our very first webinar, and I do know they appreciated that. Again, we'd like to recreate that opportunity today by asking you for what message you might like to give our listeners today.
Thank you, Marie. So in addition to, what Rachel has already said, certainly, there's opportunity in today's healthcare environment, for nurses and midwives and for leadership. There's certainly opportunities for nurses and midwives to drive innovation, to enhance the organisation and to serve the communities, and to really develop those links locally, with their local patients, their local population, and their local services, because nurses and midwives working in collaboration with the population they serve is a really, really strong coalition to form. Additionally to that, then, the coalitions and collaborations that nurses and midwives have made along this journey here now that I've referred to before, nurses and midwives, you need to continue to build those collaborations, with their communities, with their organisations, with other partners that are perhaps outside the traditional boundaries of nursing and midwifery that we would have done. We know that nurses and midwives are the most trusted profession in the system, and so that has a really sort of bonus or a great foundation on which we can enhance the profession's future achievements, growth, and influence for both patients and the services. The past 18 months, 19 months now, I think, really, as we all know, has been a real challenge, for nursing and midwifery overall. But looking back at it, certainly, nurses and midwives are equipped with the knowledge, the experience, and the skills to deliver when the data and the science are poorly defined, to form coalitions for success, and to deal with new frontiers. Finally, as Rachel has already said, I would like to take the opportunity to certainly once again to thank all of the nurses and midwives and our support staff across all of the specialties, across all of the grades, who have done a tremendous, outstanding, job in the hardest of circumstances to really support the citizens and population of Ireland. It has really been tremendous what has been done. And again, just to say in all of that as well, to take some time when you can find it to look after your own well-being as well.
Chair, thank you so much. Again, a very hopeful message and much appreciated. I'd just like to take this opportunity to thank yourself and Rachel. We asked you to end this webinar series with the title Sharing the Learning Past, Present and Future, and you've both certainly done that. I know from listening to you myself, I think the future is extremely bright and hopeful. And with all the work that's been done by both offices and everybody in terms of nursing and midwifery in the country, I just think we sometimes need to stop and say what we're doing right. We tend to sometimes here in Ireland focus on what may not be going right, but this is a real opportunity today to listen to both of you and to hear what we're all doing, and it's wonderful. And I'd like to thank you so much for coming to our very first webinar and opening this webinar series, and for ending it on such a positive, hopeful note. Thank you.
Thank you, Marie.
As we come to the end of our webinar series, It's been wonderful to think back on all that has been achieved during this series. Over the past year, we've heard from nurses of all disciplines and midwives, all of whom have come from different services and of different grades. As we commence this journey to develop this webinar series, the NCLC, CNO and RCSI hope to achieve an opportunity to allow nurses and midwives to present on their experiences of leading during the pandemic. There's so much learning to be achieved from this, and I really do believe that we achieved that aim. There's so many people to thank for this webinar series, and I'd just like to start by thanking my own team, the National Clinical Leadership Centre team, for all your support, and a lot of it was in the background, but it certainly contributed to the success of this series. I'd like to thank ONMSD colleagues and colleagues from services who helped with the shortlisting process. We had hundreds of applications for people to be panellists during the webinar series, and it was wonderful to have the expertise to support us to shortlist the applications. I'd like to thank my colleagues in the CNO and the RCSI who've worked together with us in collaboration to make this series the success that it has been. I'd like to thank colleagues in HSC Communications and HSC Digital for all your support. I would really like to acknowledge the contribution of all our panellists. It's been an absolute honour working with all of you, and I know from my own team, the CNO, the RCSI, we've really enjoyed the process. We've learned so much from listening to you, and I know from the feedback through social media and emails that all of our listeners have as well. And I wish every one of you every success as you continue in your nursing midwifery career. Last but not least, I'd like to thank you, the listeners, for all your support from the first time we started these webinars back in September 2020. I know some of you chose to listen to your own discipline, others chose to listen to a few, and some people have listened to all of the webinars. But whatever, we're absolutely grateful for your support and for you taking the time to join us to hear the experiences of our panellists. I do hope that you'll continue to engage with the National Clinical Leadership Centre for Nursing and Midwifery, and I look forward to meeting you on our other initiatives. Thank you.